What I wanted to speak to all of you today specifically is really around strategy and transformation at a time of crisis. So we have, in the last 20 plus months globally, been really living through this pandemic. And as we think about the specifics of everything that we've lived through, the opportunities in terms of global collaboration is unprecedented. And I truly believe that now is the time for us to really come together as a unified front in that element of collaboration. So what I present to you here is essentially a growth curve. And when you think about a growth curve, there is usually a seed to growth, and there are a number of good decisions that a company may make in terms of growth. And there is usually also a strategic inflection point. And at that inflection point, based on a number of the different circumstances around the industry, as well as around the company, based also on the decisions that get made, is it the right types of partnerships? Are the right collaborations in place? Are the right technology elements in place? Are the right life sciences components in place, the funding components? You can either enjoy an exponential growth, or many times what happens with a lot of companies is that there is often a catastrophic decline. And especially when we're living through a pandemic, like right now, this volatile environment is more real than ever before. We talk about how we are living through a VUCA environment, VUCA, volatile. It's very uncertain. There's a lot of complexity, and there's also a lot of ambiguity in the specifics of the healthcare industry. So at a time like this, we believe that we are at this strategic inflection point globally. So partnerships and collaboration and the right decisions in terms of what we collaborate in and how we collaborate will really define the difference between success and failure. Our perspective around leadership is pretty clear. It is very difficult globally in this environment of the volatility, the uncertainty, et cetera, that I defined earlier, to provide certainty. Very little is certain in this volatile environment. But we believe that as leaders globally, it is our imperative to provide clarity. So leadership really is not about providing certainty, it is about providing clarity. And this crisis that we're living through, we believe, breeds opportunity. So crisis breeds opportunity, whereas scarcity breeds creativity. So it's really important to understand this notion. And through the pandemic, there are 5 key observations, truths, global truths that I just wanted to share quickly in front of you. Number 1 is that we are one global community. So whether it's in the space of pharma and life sciences, or whether it's in healthcare delivery and healthcare technology, we really are one global community. Number 2, the walls between medicine, which is where healthcare has resided traditionally, and public health have really come down. So the advancements that we're seeing around, for example, vaccinations and the embrace of some of the best practices around public health, it is because of the walls coming down between medicine and public health. Similarly, and more important to the conversation we're having today, the walls between health sciences and life sciences have really come down as well. Dr. Bernd Stowasser talked earlier about how Sanofi is really leading the charge globally in modernizing clinical trials. And trials that used to take maybe 2 or more years are now happening in a matter of weeks. And we're seeing that in our organization as well at Atrium Health around various research initiatives where the bench to bedside parameters are decreasing dramatically from sometimes 10 years to 10 weeks or less. And I'll talk about some of the specifics of why that is happening. Number 4, cloud, virtual, artificial intelligence. These are not just aspirational sentiments anymore. These are must-have foundational strategies and components for organizations like us and organizations like yours. And then last but not least, and this is especially true in the United States market, the fee-for-service environment has really failed the test of the pandemic, and the march towards value-based parameters are the reality of the environment that we're functioning in. So the next slide is really talking a little bit about what's happening in the United States. And the pandemic has really been pretty devastating for a lot of the health systems and hospital systems like ours. And you can see this is under more of an optimistic scenario. So even under an optimistic scenario, hospitals could face a $53 billion total revenue loss in 2021. And under a pessimistic scenario, they could face $122 billion in total revenue losses in 2021. So clearly, there's been a lot of challenges that health systems like us have been facing at a level that has been unprecedented. So my question really is, what's one to do? How do we stop this bleed in terms of the revenue losses, but also at the same time, capitalize in on the opportunities in terms of global collaboration and moving forward with advancements, whether it is in life sciences or in healthcare technology. What we're seeing specifically at Atrium Health, but also globally, is that what was the norm way back in 2019, which is not very long ago, is now redundant, is now really archaic, and is not accepted anymore in 2020 and beyond. So what was busy waiting rooms, for example, and emergency departments and clinics are not acceptable anymore. And you see on the picture on the right-hand side of my slide, the mom at the convenience of her home is scheduling a study and engaging in a dialogue with an AI-powered chatbot, engaging in a virtual video visit with her physician at the other end, all in the convenience of their home. And so it really is a very different environment where technology has transformed how it is that we're interacting on a day in, day out basis. So the way that we work, the way that we collaborate, and the way that we conduct research, whether it's in life sciences or in clinical practice, has really transformed even in a period of just a matter of months of living through the pandemic. Having said that, there are lots of challenges in healthcare and lots of broken promises as well. So it is not just about taking a digital solution and implementing it on top of a broken process. So whether it be processes in clinical trials or processes on the clinical delivery of care, it is important to understand that if you apply digital to a process that's broken, you will essentially only end up with a broken digital process. So what we're trying to push forward with as we collaborate even at a global level is not just to apply digital solutions to existing processes, but really to innovate around those processes, to transform how those processes are being done, leveraging the power of digital, leveraging the power of global collaboration. Let me give you a specific example. So in the space of care delivery, we talk a lot about how the pandemic has transformed care delivery. And there are a number of things that we're tracking to at Atrium Health. So Atrium Health is a large not-for-profit health system based out of the southeast of the United States. We have 70,000 employees, and we have an annual revenue of over $12 billion. And when we look at the space of primary care in particular, there are lots of different challenges that are coming in. So whether it's around advanced primary care or in the urgent primary care space or ongoing care or targeted and therapeutic spaces, there are lots of outside-in entrants that are funded, well-funded by venture capital that are coming into our space. So the competitive dynamics are transforming the space of how we're even practicing medicine on a day in, day out basis. And this has only been accelerated with the pandemic. So you can see, similar to the data that was presented in the prior talk, an upward trend in the funding elements of what we're seeing in healthcare technology. At the 6-month mark in 2021, the total funding already surpassed all of what was happening in 2020. We know that the healthcare market is in a period of rapid acceleration and disruptive transition. And with that, we're seeing a remarkable bump up in the amount of funding that we're seeing. And even in the halfway mark, we are again at where things were in 2020. And the trend continues to increase. So we're now in December. And in fact, it has almost doubled what was happening in 2020. So when we think about all of those changes, part of what we're doing at Atrium Health is really thinking through the strategy. And as the title of my talk today depicted, how do we strategize and transform through this crisis? So one of the things we did was we took a step back and we said, all right, what are those trends that are persisting through the pandemic? And I've listed a number of key trends, and I won't talk through every one of these trends. But one of the things that I wanted to point out is point number 3, where the competitive landscape has really changed dramatically. And as was pointed out earlier in the quote from the CEO of Sanofi, it really isn't just about competition, right? It is about collaboration that can really transform the advancements that we're talking about in innovation. And then number 5 here is the point around learning health systems. So Atrium Health is a large academic learning health system. And at a global level, our aspiration is to really collaborate and learn from each other and continue to advance the specifics of these learnings, even through the pandemic and beyond, so that we're able to expedite drug discovery, we're able to expedite the clinical transformation elements, and expedite the elements of research and innovation in a much more rapid pace than what we saw prior to the pandemic. There are then a number of trends that are accelerated by the pandemic. And very quickly, we're seeing shifts in consumer behavior because of advancements such as virtual in the example that I provided earlier. And I'll give you another example of some of the specifics of what we're leading nationally and internationally here at Atrium Health in our hospital at home program. We're seeing digital acceleration, accelerating at a pace that has never been seen before. Public health and health inequities are really taking a forefront in the advancements that are being seen out there. And then there are very unique out-of-industry collaborations, much like what we're talking about here today in a global level. And we're really reforming care delivery, right? And we think that that trend is going to continue. So one of the things that we did at Atrium Health very quickly was right through the thick of the pandemic, at the beginning of the pandemic, we took a step back and we said, all right, we need to come up with a bimodal strategy in how we leverage some of these imperatives that we're seeing through the pandemic and really not just rise out of the pandemic, but reshape how it is that we're collaborating, reshape how it is that we're transforming our health system and beyond at the time of the pandemic. And we were at that point also integrating with another large health system here at Atrium Health, now called Atrium Health Wake Forest Baptist, and then the School of Medicine. And we're using the integration gear to accelerate our RISE and Reshape strategy. So I'll talk a little bit more about RISE and Reshape. So one of the things that we did in RISE was really focus in on our employees, our teammates, the 70,000 teammates that comprise of our researchers and our clinicians, and really encourage the specifics of how they could work more intelligently, more collaboratively at a global level. Similarly, at a Reshape element, we were pushing the needle forward in terms of advancing our preeminent learning health system and again, accelerating the specifics of how we can be faster to market and how we can really grow in terms of the scale, influence, and synergies, again, at a global level. Specifically around our perspective on consumer centricity and patient-centered care, one of the key strategies that came out of the RISE and Reshape strategy was to accelerate how we looked at the advancements in personalized care and precision medicine. with the patient that is right at the center of our focus in terms of the research and the collaborations that we were pushing forward with, including in life sciences and care transformation, but also in how we approached consumer centricity. What we said was we needed to leverage the power of data, petabytes worth of data that we have, as well as the specifics of what we were pushing forward in our learning health systems to engage the consumer, to hear the consumer, to really understand what the needs are for that consumer, and to know the consumer at a very personal level, to know the patient at a very personal level, so that we could really push forward with things like drug development, with the specifics of clinical transformation, or the elements of virtual care, so that we can have targeted outreaches to that patient that's in the center of our focus. Next, I wanted to really showcase to you one quick example of a transformational innovation that we pushed forward with at Atrium Health, called the Atrium Health Hospital at Home program. And with that, I'm going to play a quick video to showcase what we actually did.
The virtual hospital for us was a natural transition or transformation. This pandemic certainly needed a way to keep patients that are COVID positive out of brick and mortar setting as much as possible.
It is in this virtual hospital we perform advanced therapies in the home. We can do EKG monitoring, lab draws, IV fluids, antiemetics, things of that nature. So we can offer an enhanced level of service for these folks.
It really gives you a straightforward view into how a patient is living, what kind of conditions they're living in, who do they have at home.
Which is great because we're able to take care of our entire community and wrap them in this care, both medical care, social care, psychological care that they need right now.
We see patients who were admitted to the hospital with COVID on the tail end of their illness. We also see patients at the very beginning who are diagnosed with COVID. So all of our patients receive a monitoring kit, and in that monitoring kit they have a thermometer, they have a blood pressure cuff, and they have a pulse oximeter that also gives them heart rate. So we're actually putting the technology in our patients' hands so that they can do that monitoring on their own. And then telephonically, we are following these patients so that we can know which way their vital signs may be going, if they're improving, if they're becoming more concerning, so that we can act quickly and early to try to support them aggressively.
It's really leveraging a skill set that the paramedics have with technology, with keeping the patient comfortable in their own home, which is really where they do better psychologically. It seems like a no-brainer to us, and we're going to continue this work post-COVID that we started pre-COVID, because it's a huge value and win for the patient.
In the long run, I think this will change how we practice medicine. I think there will be more virtual visits.
Atrium Health is evolving rapidly, but evolving for the patient and always keeping the patients and their families at the forefront. And I think that that is amazing, innovative, and it really does. It warms my heart to know that we can help support these people in a different way.
So very excited about the innovations that we're pushing forward in our Hospital at Home program. And I won't spend too much more time talking specifically about some of the work that we're doing, but this has been now a national model that has been looked at across multiple other health systems across the United States and beyond. And the fact that we're able to really go live with our Hospital at Home program in such a short period of time speaks to some of the trends that we were talking about earlier, where, again, as we talk about not just amazing research, but the translation of that research to impact, within a matter of weeks, we were able to stand up an innovation like this and really transform the way that we were caring for our communities across the Southeast here in the United States. And those are the types of examples that we're continuing to push forward with. Those are the types of solutions that we're really excited about in terms of how do we take a program like the Hospital at Home program that we just talked about and really then transform the specifics of care transformation. So this slide here talks specifically about the virtual care continuum as we talk about taking innovative drug development and discovery, virtual care, care transformation elements in cardiology and teleneurology and psychiatry and behavioral health and many other elements, not just within the patient's home, but across the entire continuum, from the community, the primary care, to emergency, to inpatient, post-acute care, and again, back into the patient's home. What we're pushing forward with is a much more rapid pace of adoption of these innovations and translation back into the impact at the point of care, from the home all the way to the hospital. And we're seeing that accelerate across multiple different sectors in the United States, as we're looking at the value chain with multiple other companies. So for example, in remote patient monitoring, as they're coming in and really pushing the boundaries of innovations in remote patient monitoring, you're seeing a much more rapid acceleration in the adoption of these technologies. So what we're doing is, as it relates to healthcare technologies, really pushing forward with the specifics of more of a holistic strategy, right? Capabilities such as remote patient monitoring and virtual visits. We're saying, all right, how do we take the learnings that are happening in our research labs with partners in the health sciences as well as in the life sciences areas, and then put them into practice around care management workflows, managing the technologies and the devices that are often part of the solutions in pushing forward with managing things like congestive heart failure or diabetes or oncology, and then monitoring these patients in a much more holistic way and making sure that we're then able to run analytics and perform the right interoperability types of needs at the back end, so that we can then learn in that learning health system construct that I shared with you earlier. So I know that we're going to have a robust dialogue in the next section of this forum this evening or this morning, depending on where we are globally. But I wanted to end with this quote from Gregory Williams. And what Gregory Williams said is, on the other side of a storm is the strength that comes from having navigated through it. And we know that globally, through this pandemic, we have really been navigating through this global storm of dealing with the challenges, both from financially as well as from a healthcare delivery perspective, personally, in our own lives and our families' lives, but also as we're pushing forward with drug discovery and clinical trials and the advancements that we're talking about today in terms of even healthcare technology. We really do see a better side in the other side of the storm. And it comes specifically from the opportunities in terms of how we can collaborate, in terms of how we can prioritize, how we can leverage the power of data, as well as the specifics of the advancements that we're making in research and clinical transformation, and then create impact. So we can then serve the communities that we're a part of, whether here in Charlotte, North Carolina, or in anywhere in Europe or in South Korea. We are one global economy. We are one global community. And with that, I will hand it back to you, Professor, and we can engage in hopefully a robust dialogue. Thank you very much.